So, what is tensiomyography? We usually call it TMG for short. So it's a measuring device that actually quantifies the contractile properties of superficial skeletal muscles. So it gives you actually information about two properties of muscles. One is speed of muscle contraction, and the other one is muscle tonus. To be more specific, it gives you information about the amplitude of muscle contraction, but we'll go into details a little bit later. So, so far it is used in three different areas. The first that I will describe is a sport area. In sport, TMG is predominantly used for muscle profiling. So what does that mean? It depends on the nature of the sport. You measure all the muscles that are the most important from the performance point of view, and especially muscles which are the most frequently injured. In practice, that usually means that in most sports, around 10 muscle pairs, that means 20 muscles are measured, and based on that you get a muscle profile of a particular athlete. You can detect some weak points, so you can focus more on those in your training program, and the goal is, of course, improving performance and reducing a chance for an injury to occur. So it all depends on the nature of the sport. How often will you do this kind of muscle profiling? In most sports they do it 3, 4, 5 times per year. So that doesn't mean that. So it doesn't mean you have to use the equipment really frequently to get the data, which is just used for fine-tuning the training program. For example, in soccer, most teams they use it just before the preparation period with all the other tests. Based on the data, they can adjust the training program, maybe just from the perspective of a team and also as from the perspective of individual, to fine-tune the training program in order to make that person, let's say, focusing on the weak points that were discovered during the measurement. You usually then do the same measurement at the end of preparation period to see how successful this training program was, and you repeat the same thing in the second part of the season. So, like I said, in most cases that would make 4 measurements per year. Some teams, they use it very frequently, almost on weekly basis, but not for all of the muscles that are usually used at this basic muscle profiling, but you focus on those muscles which are the ones which are the most frequently injured. So in soccer, some teams they use it to evaluate the function of the biceps femoris muscle every week. Some teams, one also from UK that I know of, they focus on rectus femoris muscle because a few years back they had 13 injuries in 1 year. That's quite an unusually high number. So when you're just focusing on one muscle or maybe 2 or 3, it's not something that will take a lot of time to gather. So usually it takes just a few minutes for measuring of one subject, and if you measure the whole team in soccer, in most cases that's somewhere in between 15 and 25 people. It depends on if you're just focusing on the first team or the whole A squad. Then it will take you probably less than 1 hour per week to do the measurements. And what you get out of it is, if you see a strange change in muscle behavior, then you know that something is not right. So you can take the subject out, you can do some additional assessments. You include, physiotherapist, doctor to see what's the reason for this shift of muscle properties and work on that. So with that approach, what you can do is maybe you can prevent some future problems to develop. So, the next area in which TMG is used is medical area. To be more precise, it is used for monitoring rehabilitation process. So it can be used immediately after an injury as a diagnostic tool. In this case, what you're measuring is you're measuring functional damage to the muscle after an injury. Of course, when a muscle injury occurs, the first thing that should be done is to assess structural damage. So you can either use MRI, ultrasound. In that case, you get information about, where exactly the injury is, what's the extent of an injury. With the TMG, you get the other part of information, and that's information about how big is the loss of muscle function. In most cases, it was proven that most of our users use the TMG maybe more frequently at the end of rehabilitation process, especially when deciding when a subject that was injured should return back to maximum either training process or competition. So return to play decision probably is the one in which the TMG is most frequently, and also it's the most valuable in that case. So when you use the TMG in rehabilitation process monitoring, then the measurement protocol actually stays the same. The only thing that will change is you will change the number of muscles that you will focus on. So you don't have to measure 20 different muscles. You can maybe only focus on the one that was injured. Of course, you always measure the same muscle on the healthy side as a reference. And but the frequency of the measurement will increase. So the closer you get to the end of rehabilitation process, the more frequently the measurements will be. So in the last week, maybe some of the users, they measure every day to see when the muscle is ready to take the maximum stress again. So some of the users, they also use it as a tool to see how a certain treatment affected the muscle function. So you can do before and after a certain treatment to see if the properties that you wanted changed or not. So the medical field usually requires, again, more detailed approach, but the higher frequency. The last field, the research field, is the one that you are probably most interested in. So we have many scientific publications that were published using TMG. Last year, I think there were 16 new publications, so every year the number is growing. In the beginning, the research papers were mainly more or less about validating the TMG, because when it was first invented in just maybe before the year 2000, you have to establish the TMG as a valid tool. So you compare it to some existing tools, or you try to prove that you're actually measuring something relevant. So one of the best papers probably in the beginning were comparing the TMG with actual muscle composition, and it was proven that with the TMG you can get quick and non-invasive estimation about muscle composition. So what's the relationship between fast twitch and slow twitch muscle fibers? Lately, most of the publications are more practically oriented, so the TMG is already established and it can be used to monitor how a certain training protocol will improve muscle function, how a certain maybe treatment after training will affect muscle function, in order to see which approach will help in regeneration of muscles after workout. So this kind of papers were published lately. So now let's move to the part to actually describe what TMG is all about. So how does it work? What are we actually measuring? So this Display here is very simplified, so you only have 3 components. We'll start with the thing that we are actually measuring. So what you do is you position a subject that you want to measure on the massage bench in most cases. So that means that we are, like I said, we are measuring muscle function, but we don't require a voluntary involvement of the subject. So we are not measuring what a certain subject is doing at a certain time. So we are not measuring subject when they're running, when they're jumping. The other methods can cover that. What we are measuring is the quality of the muscle. So what's the potential of the muscle that we are measuring. So in this display, we are measuring the biceps brachii muscle. We are using, in order to have standardized, repeatable, objective conditions, we are measuring an external source that will evoke muscle contraction. In that case, we are using electrical stimulator, and the goal is just to evoke one muscle twitch. So for that purpose, the stimuli that is used is always the same. So we are using the stimulator to just send 1 millisecond long square impulse, monophasic square impulse, so the muscle will just one time it will contract and relax, and the whole cycle is very fast. Of course, it depends on the quality of the muscle, but the whole thing usually it's over within 300, 400 milliseconds. With the displacement sensor, which is placed over the belly of the muscle that we are measuring, we are actually monitoring the formation of muscle belly in radial direction. And as a result, we will get time displacement curve that I will show you in a minute. The only thing that we actually change during the measurement protocol is the intensity of stimulation. So what we want to get as the result, we want to get maximum contraction. And you never know, it depends on the subject, it depends on type of skin, it depends on how much fat is there between the skin and the muscle, how much current will have to be used to get to the maximum. So the measurement protocol usually is very short. We start low and we gradually increase the intensity until we get maximum response. In practice, that means that it shouldn't take more than 30 seconds or even less to get from the first stimuli to the last. Usually it takes about 5 or 6 steps, as you will see later on. Of course, we need some accessories to make the measurements easier and, let's say, more objective. This is the whole setup. You can see it also here. So, as I said, the subject has to be relaxed in either supine or prone position when you're measuring legs. If you're measuring upper body muscles, in some cases it has to be in upright position, but let's focus on this. So we have a massage bed here. We have support pads which are used to support, in this case, a lower limb in order to create 30 degrees flexion in the knee when measuring quadriceps muscles. So the support pads are used again to ensure that the conditions in which you are doing the measurements are always the same, so you can repeat the measurements in the same conditions, so also you can then compare the results, not only between one and second measurements, but also between the other subjects that were measured in the same, with the same criteria. For the sensor to be held in the right position, we use the camera tripod with a mechanical arm which positions and holds the sensor over the muscle during the contraction. And that's it. So you obviously don't need this medical card, but the whole system is portable. It is frequently used. It's not meant only for laboratory use. It is frequently used in the pitch, on the track. So because sometimes you are not just measuring a subject or a muscle when it's, let's say, without any external effects on the muscle. Sometimes you want to see how a training affects the muscle functional properties. So that means that you will have to take the equipment to the gym. You will do the measurements before and after each set of an exercise to monitor what's going on with the muscle. So it's also battery operated. So the stimulator can probably hold for more than 50 hours. So the limiting factor in this case would be how long the battery in the laptop will hold. So this is how the whole setup looks like. As I said, you can also see it here. This is just the display on, how this sensor tip is positioned over the muscle and what happens when the muscle contracts. So this tension here, which is placed on the muscle fibers by the sensor tip, that's why we have this tensio in tensiomyography. So because some researchers, they also try to use some other tools to monitor what's going on with the muscle during the contraction, but the results were not as stable and repeatable. So it was found out that this is a crucial factor. You have to have the constant contact with the muscle belly, with the muscle fibers of the muscle that you're actually measuring. So when the muscle contracts, it will push the sensor tip in, and again when the muscle relaxes, it will come back to this. And what you get as the result, it's a time displacement curve, which you can see here at the end. This time displacement curve is divided into 5 different parameters. So this is muscle twitch. If you look in literature, in most cases what you will get, you will have time to peak and then you will have time to relax. But the amplitude usually is not measured and it's not determined. So I will quickly describe all 5 parameters, but I can tell you, of course, there are some researchers, they will disagree a little bit, but the fact is 2 of the parameters in all the publications in research so far proved to be more important than the other 3. So let's start in the beginning. Time 0 is the time of when muscle gets a stimuli. So it takes some time for the muscle to react. We call it delay time. This delay time, usually it's quite stable. Also it's quite similar. It's not a big difference between different muscles. It's not a big difference between different genders. Age groups maybe a little bit. It prolongs a little bit as you age. But the thing is, if the muscle is healthy, if everything is okay, then this delay time will be very stable, and that makes it a parameter that you will not focus on very much. But on the other side, on the other hand, if a muscle is injured, so if you have an acute injury, this delay time will probably prolong a little bit. So in that case, of course, you will get a warning, okay, this delay time is prolonged, and you will know that something is wrong with the muscle. But like I said, if everything is okay, if you're measuring healthy people, then this delay time will not be, let's say, the most important of all parameters. TC, contraction time, the next parameter, on the other hand, it is the most important parameter monitored by the TMG. It tells you how long does the muscle need to get from completely relaxed to completely or maximally contracted position. And this is the parameter that I was already mentioning. So this parameter has more than 90% correlation with muscle composition. So the more fast twitch fibers you have in the muscle that you're measuring, the shorter this contraction time will be, and vice versa. It also has quite high correlation with some of performance tests. But the biggest value of contraction time probably is its sensitivity, because contraction time will show you if the function of the muscle changed. It can change for a number of reasons. So you can do something to activate the muscle, so you can detect potentiation. If you do something that will generate fatigue. You can also detect fatigue, but the biggest change in contraction time will be immediately after an injury. So after an injury you have inhibition, which prevents part of the muscle fibers to contract, and you will see a big shift to the right. So this contraction time will prolong drastically. So probably this is one of the reasons why the contraction time is the parameter that we'll monitor closely. The range of times that you will get is quite big. So some muscles, of course, overall some muscles are, because of its function and the structure, are more explosive, are faster than the others. But if you compare professional athletes from different sports, even if they are dynamic, explosive sports, you can see quite a big range of values that you can get. So I will try to at least give you an idea of what you can expect later on, but in most cases these contraction times can range somewhere from 15 milliseconds for extremely explosive muscles up to 60 or even 70 for either very slow muscles, so predominantly slow twitch muscle fibers, or the muscle which is injured and it cannot activate fast twitch muscle fibers. So these two parameters combined will give you time to peak. The next two parameters that I will describe are sustained time and half relaxation time. These two parameters will monitor the second part of cycle, the relaxation phase. And so far these two parameters didn't prove to be as important as the contraction time, for example. So probably there are a couple of reasons, and one of them for sure is the fact that because we are using superficial electrodes, it is impossible to contain the electrical field in just the muscle that you want to monitor. You will also, in most cases, when you're measuring, especially when you're measuring small, thin muscles, you will stimulate deeper muscles, neighboring muscles that will also contract, and this movement will somehow generate the second, or sometimes generate the second peak, and this second peak will affect these two parameters. And sometimes this co-contraction can be weak, sometimes it can be strong, and also even if you're measuring the same subject, the same muscle on different occasions, sometimes a little bit more electrical field will penetrate in the deep muscle and you will get a little bit bigger contraction, sometimes less. So these two parameters are not as stable as the contraction time. One PhD student in Slovenia, he's now trying to develop a formula, an algorithm that would try to somehow isolate the first peak that will be generated from the superficial muscle and the second peak that will be generated from the deep muscle, but so far we're not there yet. So this is the reason why usually you don't put too much emphasis on these two parameters. But again, there is an exception. Almost every time you will measure lower back muscles, so the erector spinae muscle, on a subject that has lower back issues, these two parameters will be prolonged drastically. That means 200, 300%. So even if you look at what's going on with the muscle will contract and then will hold on to contraction and really slowly relax. So in that case, of course, this is the sign that something is not right around that area, and at that time you will take these two parameters under closer look. In other cases, maybe not so much. But again, it's all up to you. Like I said, some researchers, they focus a lot on these two parameters. In most cases, they're not. So these 4 time parameters are quite objective, so you can compare different genders, you can compare different muscles, different genders, different age groups. If you have short times, then that muscle is explosive, it's fast. If they're very long, it's either, like I said, predominantly slow twitch, or there is something wrong with that particular muscle. The fifth parameter, we call it displacement. It records the difference between relaxed and contracted muscle. So it gives you the amplitude of muscle contraction. On the other hand, it cannot be compared between different muscles, because obviously if you're measuring a small muscle like tibialis anterior and gluteus maximus, for example, to compare these two results wouldn't make any sense. So in most cases, again, if I just talk about some numbers, when you're measuring, tibialis muscle, you will get like 1 or 2 millimeters of movement. When you're measuring glutes, you will get 15. So to compare these two numbers wouldn't make any sense. But since apart from the volume of the muscle, the second thing that will influence displacement is muscle tonus, to compare the same muscles, especially left and right, and also to the reference values, this is something that will give you a valuable information if the tonus, if the stiffness, if the tension in the muscle that you're measuring is appropriate or not. So of course, when you are comparing your results to the reference values, you try to compare your results to the reference group, which is as closely has the same properties as you have. So it has to be same gender, it has to be same age group, and it has to be same type of activity. As you will see later on, we have very specific reference values. But what I wanted to stress here is when you compare this parameter between left and right on the one subject, especially on the muscles that comes from pelvis, so like biceps femoris, rectus femoris, that means that you can detect some postural issues that maybe some athletes were not aware of, and that happens quite a lot of times. So if you see that there is a big difference in tension between left and right rectus femoris, left and right biceps femoris, you can see that if you make a closer look, maybe the pelvis is rotated, tilted. So you can also try to work on that. So this parameter I would say it's the second most important one. And like the contraction time, it is also very sensitive. So if the function of the muscle will change, the displacement will change. So not only that it will show you if the tonus of the muscle is changed, it will also show you again if you have an acute injury and some muscle fibers are not participating in muscle contraction, this displacement will change drastically. That means it will be much, much lower, of course. So to sum up, contraction time and displacement are the two parameters that most of the users are focusing on. Again, it's not something that I'm telling you should do, but I'm just telling you that most of the users are focusing mainly on those two parameters. So we can just go quickly through that. I don't know if you can see it clearly, but we have a few different scenarios of combination between contraction time and displacement. So what you want to get, if you're measuring an athlete who's involved in dynamic sport, what you want to get short contraction times, and you want to get optimum displacement. So if you get that, you say, okay, this muscle is how I want it to be. If you do something to, after the measurement, to activate the muscle. So, for example, I'm doing the measurement on one of the quadricep heads. Then I do a few vertical takeoffs with maximum effort, measure again. These two parameters will change a little bit. That means that the contraction time will shorten, so the muscle will become even a little bit faster, and the displacement will increase because a little bit more activation in the muscle will happen. On the other hand, I'll just skip this for now. When you do, instead of 5 jumps, you do 50 or 100, then of course the muscle will be fatigued and the shift will be into the other direction. So the contraction time will prolong, displacement will drop. So we'll get shift down and to the right. The same thing will happen when the muscle is injured, but the scale would be probably completely different. So usually fatigued muscle has the TC, the change of TC will be like 10, 15, maybe 20%. If you have an acute injury, it can be 100. So you can go from 20 to 40 within minutes if you do a sprint and then you injure your biceps femoris and you measure immediately. Then if you don't do anything for a long period of time, again the contraction time will prolong, so you will again have the shift to the right, but since you're not using the muscle as you should or as you did, then the displacement will not drop, but it will increase. And this is one example that I would like to show you now. So it is a biceps femoris of a sprinter before injury. So these numbers at this time doesn't mean a lot to you. So displacement is 4 millimeters. You know, I know that's more or less normal for a sprinter, male sprinter, but you know you don't. So, but take my word for it. So that's about the right amount of displacement that you would like to have. Contraction time 20. It's not super fast. Some of the world best sprinters, they have around 15, 16 milliseconds. But it's not bad. Okay, so after an injury, you can see that drop down and to the right. So the increase in contraction time is immediate. It's about 30% difference, and displacement is much, much lower. So what you're missing is you're missing, you know, some of the fast twitch muscle fibers that are not firing because of inhibition after an injury. So what you would like to get is go from here back to here as soon as possible. But since you cannot use the muscle as you did because of an injury, it will go into this direction here. This is an extreme example. That's why I'm showing it to you. So if you don't do anything for a few weeks, so if you don't treat your injury, you will get, you know, the TC will even prolong even more, and displacement is much, much higher. So the muscle loses tonus completely because it is not used anymore. So you should prevent that if you want to focus on returning this subject back to the training and competition as soon as possible. But it is a quite nice example. Okay, now we'll talk about reference values that I was mentioning before. So when you do the measurement, of course, when you get, you know, these numbers that I was just showing, if you cannot compare it to some other numbers, they don't mean much. So in order to do that, so of course the first thing that you will get after measuring a certain muscle, you will get reference values shown at the same time. The reference values for some sports are very strong, I would say. So for soccer, we have thousands and thousands of soccer players measured, and these reference values are available in the software. But for some sports that are not maybe so popular, it also depends on the country. We have maybe a couple of hundred people measured. In some sports, maybe just 20 or 30. But nevertheless, you compare the data that you get with the group of people that do the same thing as you do. And if you have some specific group that you want to focus on, you can also generate your own reference values as soon as you have enough subjects measured. So these numbers that are shown here are the average of more than 10,000 male subjects, different age groups, different sports. So as you can see, if you just focus on contraction time, it goes from 19 to 46. So this is the fastest in this example, I think, and that one is the slowest. So the others are in mid-20s. If you would take a group of world-class sprinters, 9 out of 10 would be below 20. So the only one that would be probably a little bit slower are the glutes. All the others would be sub 20, maybe even closer to 15. So if you take a world-class soccer player, most of these numbers would be in low 20s, so 21, 22. So it all depends on which sport you're looking at. So obviously the fastest people on the planet are the sprinters, and clearly they will have the shortest contraction times. But the thing is, these properties will be quite different even if you're looking at the same sport. In soccer, we have 4 different reference values. We have offense, defense, midfield, and goalkeepers, obviously. So this is the first thing that you will get as the result. You get the numbers of the subject that you're measuring, and you get the reference value, and you can see, okay, faster, slower. The other values here are displacements, and you can see that, like I said, it's somewhere from 2 millimeters, in this case up to 10. In some sports, you know, or if you're measuring sedentary people, you can get up to 20 maybe, because, you know, sedentary people, they don't have much of a muscle tonus, so the displacements will be quite high. These 10 muscles which are highlighted here are the most frequently measured muscles. So if you have a subject who is involved in sport which predominantly use lower extremities, these 10 muscles will be measured. So sometimes adductors are not measured, so if you have a sport in which there are not a lot of lateral movement, these adductors are maybe not as important, but at least these 9 muscles, the other 9 muscles, if you run, you will use those muscles, and it is very important to see what are the properties. So again, so Lewis will tell you he works with swimmers a lot. You will probably need also information from the upper extremities, the upper body. You know, you can measure all of the muscles or most of the muscles which are on the surface. So in that case, you would measure also the pectorals, lats, deltoid muscles, arm muscles. So the only limitation probably is if the muscle is so very small that you cannot isolate it and you cannot put a sensor on it, you cannot measure it. So if you would try to measure some flexors of the fingers, you know, individually, you can't. But you can measure as a group. So these are, again, the most frequently measured muscles. This is the print screen from the software, and this is the first information, like I said, is that you will get. You get the curve of a random muscle in this case, and you get all 5 parameters displayed below, and you get 2 numbers for each parameter. One number is the number of the subject, the other one is the reference value. And in this case, for example, the first column and the last one are the 2 most important ones. So in this case, contraction time is 5% slower than the average. So you get a yellow color, so you will get 3 different colors. You get green if you are faster than the average. You will get yellow if you are, you know, up to 20% slower than the average, which is considered, you know, adequate, acceptable. And if you are more than 20% slower than the average, you will get a red color, and it will tell you, okay, this muscle is slow. For the displacement, you have also 3 different colors, but the logic is slightly different. So you get a green color if you are within plus minus 30% of the reference values. So that means that you are about in the optimum area of muscle tonus. If you are with the displacement, if displacement is too high, it will turn into a violet or purple color, and it will say, okay, this muscle is too loose. And on the other hand, if the displacement is very low, the color will be, here it's not very well visible, but it's light blue, and it will tell you, okay, this muscle is too stiff. So here you have the explanation of what the possible colors should mean. So what you're looking for all green, if possible, but in most cases it won't be. So this is the first feedback that you get. It's interesting, but maybe not very useful yet. So When you are measuring, when you finish with the measurement, you can do many different things. You can, if you're a researcher, you can just take the raw data and play with it. But the software will offer you 5 different reports to generate just based on what you want to see or who you want the results to be shown to. So in most cases, these symmetries listed here will also be calculated and displayed. So because it's not only important or it's much less important that you compare your values to the reference values than to compare the muscles within your own body. So obviously you will always compare left and right side, especially on the muscles which are involved in running in that case. So the lateral symmetry will always be calculated. Then you have 2 types of functional symmetries that will also be calculated and displayed. First are the functional symmetries between agonists and antagonists, and not for all the joints, but we have for the big ones. So we have for the knee joint, we have the comparison between knee extensors and the knee flexors, and we have the same thing for the ankles or the dorsal flexors and the plantar flexors, and the elbow, obviously. But there is maybe also one very interesting functional symmetry which can be calculated, and that's the functional symmetry between synergistic muscles. So they have the same function but different effect on a certain part of the body. In this case, we have 2 of those symmetries. We have the symmetry between medial and lateral quadriceps to see the effect on the pectoral tendon, because every time you measure somebody who has an issue, inflammation, injury, you have a big difference between medial and lateral side. The same thing goes for the Achilles tendon. So when you compare medial and lateral gastrocnemius, you will find some difference between these 2 when you have subjects with Achilles tendon problems. So this is something that is automatically done, and immediately when you finish, you have a choice of 5 different reports that can be generated. So I will just quickly describe each one. Then if we have enough time at the end, I will show you all. If not, I will just show you the highlights. Okay, so the individual report is the one that it's the most frequently used. It's very detailed. It's about 10 pages long, and it will give you, a lot of numbers, a lot of text also. So usually it's intended to show it to you. If you're measuring an athlete, probably you will not give it to the athlete. You will give it to the coach, to the physiotherapist, to the doctor if the person is injured. So it is, like I said, quite a detailed, and sometimes the athletes don't understand, and they don't care about too many numbers and curves. They maybe can get even confused. So in that case, what you will get a short report which is just 1 page. It will just show you, okay, these muscles need this and this. So you should do, activation exercises for that muscle. You should do strength exercises for that muscle, and that's it. If you want to monitor changes in time, you will generate trend reports. So the trend report, it can be used for 2 different purposes. One is just to monitor the effect of the training protocol. So if the changes that you expected actually occurred or not. So if you want to make a certain muscle faster, you can see if you're actually doing that or not. So, but more frequently, this report is used for monitoring rehabilitation process. So what you will get, you will compare the injured to the healthy muscle. You will have a big difference in the beginning, and then when the properties come together, you can say, okay, function of the muscle is back to normal. You can put the maximum stress on the muscle again. Team report is used when you are working with a team and you don't want to give to the coach 25 different 10 pages reports because it's just too much data to go through. So what you what you will get, or what the coach will get, he will get just an overview of the whole team with just some basic information about each individual. So again, if he's more interested in a certain individual or a few of them, you can additionally also generate individual reports and look at that. And the last one is single muscle report, which is used to, in most cases, was designed for return to play decisions. So go, no go. So you're measuring in the morning, in the evening you have a match. If the muscle is, back to where it should be or not, you have to wait a little bit longer or not. So let's go through the basic highlights of the report. So this is what I was talking about. This would be the summary of everything. So what you get is, you get the list of all the muscles that were measured, in this case only 5 of them around the knee joint. And if some of the muscles need some additional attention, some additional intervention, they will have a color which is displayed here. So if you get the red color, that muscle is slow, too slow, and it needs activation exercises, so you need to make that muscle faster. So the reasons can be either poor lateral symmetry, poor functional symmetry, the muscle can be much slower than the reference values. Of course, this will be explained if you generate the long report, and it will tell you, okay, you should do this, but the reason for that is that and that. Then on the other side, you have, if you have a violet color or a light blue, it's an issue about muscle tonus. Either if it's too loose or too stiff. If it's too loose, you need to tone up that muscle. So in that case, you have, vastus medialis and vastus lateralis on both legs. And if the muscle is colored in light blue, the displacement is too low, the muscle is too stiff, you need to stretch or relax that muscle. So if you're measuring healthy person, you will get this recommendations. So do activation exercises, do strength exercises, do stretching exercises, try to relax that muscle. If you're measuring injured person, you will obviously not get this kind of information. It will just tell you, okay, the contraction time is too slow, displacement is too low or too high. Why? Because, software will automatically tell you the muscle is too slow. So of course, the injured muscle will be slow, and the software, if you would just leave the diagnosis as healthy, it would tell you, okay, the muscle is too slow, work on that, do activation exercises. Obviously, it's not the logical thing to do, but sometimes people don't follow that. So this is the summary of everything. Again, like I said, if you want to get a detailed information, you can also get this kind of information. So all the recommendations are then based on actually comparing, in this case, lateral symmetry. So you have all the muscle pairs here, left and right, all 5 parameters, and then you have the overall symmetry between left and right. So again, it's up to the end user, but software is designed in the way that it will give you a warning and recommendation if the difference between one and the other is more than 20%. I'm talking about speed of contraction. So if you have the difference which is bigger than 20, you will get a warning and you will get recommendation. In this case, you get a red color here. All the other symmetries are quite high. Obviously, what you want to get, the perfect scenario would be the symmetries which are 95% and higher, but in most cases that's not the case, because sometimes these symmetries or asymmetries between left and right side, you will hardly detect it when even if you're training every day. Sometimes it's a postural issue that you were not aware of. It can be that some old injuries were not completely healed, and you will still have some deficit between injured and healthy side. So this will help you focus, or it will help you determine a weak point, and then you can focus on. Of course, the first step would always be find out the reason why this actually occurred. So you find the cause, try to work on that, and at the same time work on the recommendations that were assigned by the report. And then you have the same here for the functional symmetries. And you can see we have 6 different functional symmetries. Again, this is one part of the report that goes into the detail, but again, some of the users, they don't want that. This is the highlight of the team report. So again, on top, what you get the basic information about each person, but at the end, you have the summary. This is, in this case, you have, let's say, around 15 players that were measured. Then here you have the muscles which were measured. So you have the adductor longus left and right, biceps femoris left and right. So if you look at this, so this is the summary of the whole team. What you get in this case, you see a cluster here for the gastrocnemius medialis and the rectus femoris. So that means that from the team perspective point of view, these 2 muscles are the ones with quite a lot of issues. So as a strength and conditioning coach, you can say, okay, why? Why we have so many issues, and can we do something about that? So, and if you look at horizontal, you can just check how many issues a certain player has. So in this case, if you look at the second one, he has none. If you look at this one, he has 1, 2, 3, 4, 5, 6. Again, so why this person has so many asymmetries, has so many issues? Again, what can we do about it? So should we focus a little bit more on this individual or not? So in most cases, what the strength and conditioning coaches do is based on this summary, they form 3 or 4 groups of the subjects. So the people that have some issues with the biceps femoris, they form the one group. The ones that have issues with calf muscles, for example, the second one. And when they're doing the strength and conditioning training, one part of the training, maybe just a small part, will focus on these specific needs based on the TMG measurements. Some strength and conditioning coaches, they go into details and design an individual program for each subject that will focus on all of these issues. It's just up to the end users. But it's very, fast way to see the whole team and to see where the issues are. This is an example of return to play decision, and we call it the single muscle report. So it's not the whole, but this is just the summary. Again, you have the speed symmetry, so the contraction time symmetry between injured and healthy, and you have the tonus symmetry between injured and healthy. And what you're looking for, again, it's high numbers, and you're looking for a green color. In this case, the tonus is okay, it's not perfect, it's 86%, so it's quite similar tonus between injured and non-injured, but the speed symmetry, it's quite bad, 73, so it's almost 30% difference between injured and non-injured, so you get a red color. And in this case, the recommendation would be wait. So the muscle function is still not back to where it should be, so you need to work on that muscle a little bit longer before you can put the maximum stress on the muscle again. This is an example of the monitoring the chronic changes. You can see in this case more than 2.5 years, the contraction time of, I think it was a vastus medialis muscle, and you can see that in the beginning there were some differences between left and right, but for the last 2 years it's very stable. The symmetries are very high, so it's not a big change. So that means that this is a football player, a soccer player. So that means that this muscle was not affected by different parts of season very much. It was not affected from one season to another. So the properties are quite stable. In most cases, you would use this. That's why I chose it actually. But in most cases, it's a little bit more up and down because some of the muscles properties will change a little bit more. So especially those that are a little bit more susceptible to fatigue, the bicep, the hamstrings with the soccer players, usually during the season the properties can change, can fluctuate a little bit more, but it will change drastically, obviously, if you will have an injury. This is just an example of 3 different measurements. So because we didn't have the measurements before an injury, this is just an example of healthy and injured muscle. So it's about 20% difference in contraction time after an injury. So then after a few months, because they worked on that muscle, but usually, of course, this time period should be much, much shorter. It's just this example is of the measurements that we did predetermined, so we didn't follow rehabilitation process. So the symmetry then on the second was 99, so the difference between left and right is quite small, but on the third measurement, again, the symmetry is quite high, but both muscles got much, much faster. So it's just a tool that will enable you to monitor what's going on with a certain muscle, either if it's injured or not, or if you're just focusing on that muscle during the training process. Okay, this is just one part of the muscle injuries clinical guide that was written by these two institutions. Yeah, you can get it there. This is, just to prove that the last thing I show it to you, so you can use it as a functional test when deciding if the subject is ready to return to play. So the tensiomyography is positioned in the second part or the last part of rehabilitation process. Maybe just a couple of examples before we finish with this part. I will show you a few examples, how the TMG can also be used to complement other methods. In this case, it's a comparison between MRI and the TMG of a female sprinter. So both assessments were done on the same day. So with the MRI, you can see where the injury is, what's the extent of an injury. With the TMG, you can see the loss of muscle function. And in this case, you have two choices. If you have the measurement before injury, you can use that as a reference. In this case, we didn't, so we just compared healthy and injured leg to see what's the difference. And the difference in this case was quite high, 43%. The contraction time prolonged in this case. So the thing is, the TMG can be more useful. So we're not saying that the TMG is better than any other methods, but I'm just saying in this case that when the subject is very close to being healthy again, so being ready to return to play, if you're using the imaging methods like MRI, the structure will be fine. And sometimes the function is not yet. And that's why so many re-injuries occur, especially in soccer. I think the re-injury rate for the biceps femoris, it's 23%. So every fourth subject after 2 or 3 months, I think, gets re-injured. So something, maybe they're not waiting long enough. So it's not enough that only the structure of the muscle is okay. The function of the muscle also has to be back to normal before you can put the maximum stress on the muscle. This is an example of how you can use the TMG to monitor muscle fatigue, for example. This example would be monitoring the biceps femoris muscle during the sprint training. So you do a measurement before. In this case, this blue line is before the first run. Then after the first run, you get potentiation. So as if you remember from the beginning, you will get slightly higher displacement, so a little bit higher activation. And then after each run, you get shift down into the right. So less and less or more and more fast twitch muscle fibers are not firing because they're just too tired to participate. So why would you do that? To see how many runs, how many sets of a certain exercise a certain individual can take before fatiguing too much. Because there is a theory, it's not confirmed yet, but also it makes some kind of sense, is if you want to to make muscle faster, if you want to make muscle more explosive. So for high-speed training and explosive training, you must always work in the so-called potentiation area, so where you have no fatigue. So you wait long enough for the muscle to completely recover before doing another set, and you have to stop with the number of sets before again the fatigue will kick in. So it takes a little bit more effort, so usually you need to take the TMG somewhere else, and you have to do many more measurements, but the value of information sometimes can be quite high. So this is quite a nice example. So you can see that after the 6th run, the fatigue is very, very obvious. So if you would continue with this type of training, not only you don't train the properties that you want, you will increase the chance for the injury to occur, because also the coordination between muscles will be much lower. So this is one nice example of what you can do with it. You can also use it to see how long does a certain muscle need to recover after a certain training. So again, you will do a certain training. In this case, it says muscle fatigue protocol. This was an example of laboratory experiment. We took the biceps brachii muscle. We used titanic electrical stimulation to really fatigue the muscle. And then after that, we measured every 15 seconds. So as you can see, displacement here dropped by almost 50%, and it took about 6 minutes to stabilize. It didn't get back to normal, but it stabilized here. The contraction time went from 27 to 31, and again it took about the same time for the parameter to go back to normal. So again, why would you use this information? To see how long a certain person after a certain type of exercise needs to rest until you can get maximum involvement of that particular muscle again. Okay, so these are just some of the benefits of the TMG as we see it. It's not invasive, so that means that you can do the measurements immediately after the muscle was injured, and you will not create additional damage to the muscle. You can do the measurements, before training. You will not create fatigue. You can even measure just before competition to see how the muscle profile looks, at the time where the subject is, let's say, at their peak, because in some sports, when you have 1 or 2 big competitions per season, you plan everything that you will be the best on that particular day. And if you can record that, that's quite a useful information. It is selective, as you probably got the idea, so we can measure individual heads. So we can compare the different heads within, let's say, the same muscle to see if they have the same properties or not. It's simple, as long as you know your basics from anatomy and muscle physiology. You can do the measurements within minutes. It is objective. Since we are using the external source to generate contraction, the subject cannot affect the result that we will get. So if you do performance tests, if they are not motivated, you can get the results that are not, that they don't show the real picture. In this case, that's not the case. So this is, we saw, because we also offer services to professional teams, national teams, in many different sports, and sometimes the motivation can be an issue, and TMG will give you the objective results, and you get results immediately. So if you choose to generate one of the reports, then you will get the results immediately. If you are a researcher and if you want to play with it, of course you get the raw data, and then it can take hours, weeks, months, until you get the results that you're looking for. So this is just a summary. So what I will do now, I will just jump a little bit back and show you a full individual report, and then we'll make a break. So First page, usually it's always the same, it shows this picture. Then on the second page you have the explanation about the protocol of the measurement. You have the explanation of all the parameters. Then you saw this already. So you have comparison between left and right for all muscles and all parameters, and overall symmetry is displayed at the end. Then you have functional symmetry is displayed here. Again, all red numbers are the numbers that you have to focus on. So when you have a red number, later on you will have some warning and recommendations on what to do. You have the same thing displayed here. Again, lateral symmetry and functional symmetry, not with so many numbers. It's just, okay, you have to be in this green area and you're fine. Of course, the closer you are to the center, the better. So this is what you would like to get. If you're outside green area, you will get the warning. So that would mean that the lateral symmetry for one of the muscle groups, you have them here, is off. In this case, all the lateral symmetries are fine. Most of them are higher than 90%, which is good. For the functional symmetries, on the other hand, you can see that for both left and right, Achilles tendon symmetry is not good. For knee, so the quadriceps to hamstring ratio is also not good. This symmetry, I will not explain it to you since it's not so very important. If you are interested, you can ask later, but for now I will just skip it. Then what you get comparison to the reference values. First you compare the contraction time. So you have all the muscles again here, left, right side. Again, what you would like to see, everything in green. If you have everything in green, that means all of your muscles are faster than the reference values. If you are just a bit outside, so up to 20% slower than the average, you're in adequate area. That means that, okay, you're not fast, but good enough. If you would be outside that area, the muscle would be too slow, and again the warning would be given and recommendation would be given. You have the same thing for displacement or muscle tonus. This green area would be an area of the optimum tonus. If you're on the inside, the muscle is too stiff. If you're on the outside, the muscle is too loose. Again, you would like to see everything within. So for both erector spinae muscle here, they're both a little bit loose, and left biceps femoris is a little bit stiff, left gastrocnemius medialis is a little bit stiff, all the others are somewhere around the average values. Then what you get a really detailed graphic and numeric comparison between reference values and values for this subject, and in this case between left and right side. So you can go muscle by muscle and compare. So what you would like to see, of course you would like to see two curves that are right on top of each other, especially up to here. Like I said, this second part is not so very stable, but you would like to see from time 0 to maximum peak, you would like to see about the same times, and you would like to see about the same amplitude as possible. So you go muscle by muscle, and then you come to the display that I already showed. Just let me make this a little bit smaller. So this is the front view. So we measured 5 muscles on front, and some stayed, gray. That means everything is okay. If you have some additional colors, in this case a lot of red, that means quite slow muscles. And from the back view, you see that we saw the lower back is a little bit loose, left bicep is a little bit stiff. So you have the explanation of what type of exercises you should do at the bottom. And beneath that you have the explanation in text. If everything is okay, you get one sentence, you get one line. If there is something to describe, you have it here. With the bold, you have recommendations. So these recommendations goes with the colors that were shown above. So if it says you need to do activation exercises, you go up and you will see that muscle will be colored in red. And it finishes up with the contraction time and displacement on the absolute scale. So again, these are the reference values from the sport, and if you have green, that means you're faster than the average. If you are yellow or red, in this case no red, you're slower than the average. And the same for displacement, or the same for the muscle tonus. You need to be in this area. If you're outside, either too loose, too stiff in this case, or too loose in that case. So that's altogether around 11, 12 pages. It depends how many muscles do you measure. And that's the last thing that I wanted to show before we make a quick break. So I don't know if there are any questions. Should we do it now or now? Okay, so yeah, please. Questions? Everything is clear. Okay. Yeah.
Last one. In your experience, how popular do you think TMG is getting? So, in terms of the clubs that are using it, do you see that it's potentially going to be the next technique for informed return to play and for injury prevention?
I would certainly hope so. So the thing is, we have more and more clubs using it. For some, we get a feedback. From some clubs, we don't. So, but it all depends on, sometimes it depends on who in the team is actually using the TMG, because if the medical team is using the TMG, it's more or less for return to play decision. If the strength and conditioning team is using the TMG, is more or less to fine-tune the training program for the team and for the individuals. So, but the question was, if it would be, it become a standard for return to play. Like we certainly hope so, and we think it has a potential. Of course, it cannot be the only thing that is used, but for sure it's becoming one of the most important tools to make that decision.
Just on the intervention side of it, when you're given the prescription.
Yeah.
For example, when you say that activation exercises are needed, activation could be considered quite a broad term.
No, I know.
Is there any more detail in terms of if you're wanting to improve contraction time, for example, velocity of movement and displacement within them activation exercises?
So the thing is, you're right. So the term, the activation exercises, is not the most appropriate one, but we found it difficult to say, okay, do some explosive exercise or something like that. So if the recommendation is activation exercise, the goal should always be make that muscle faster. So sometimes, that's all a strength and conditioning coach needs in order to make a training protocol that will actually do that. We always supply the TMG user with some videos, some examples of the exercises that are proven to be effective to achieve that goal. So, and we also try to make it as selective as possible. So in most cases, let's say the biceps femoris muscle in sports that we experience is probably the most frequently prescribed muscle to improve the speed of contraction, and it is also quite difficult muscle for most strength and conditioning coaches to make faster. So that's why, because just to explain, the inventor of the TMG and also most of the early users came from track and field, from sprint, from long jump. So we think that we have quite a lot of experience developing just that. So we give some videos, some short videos of the exercises that should,
Okay. Why don't you show one activation like recommendation for biceps femoris? One video. Usually videos fix
So we try to give many different examples, because sometimes the exercises that are used by the strength and conditioning coaches are limited by the things that they are using. So if you're working with a team of 25 people, you cannot, if you have 10 subjects that have biceps femoris which are too slow, they cannot go, use the machine. Maybe it would be the most effective, but you cannot make it work within your training regimen. So we try to also give, this is one example that you can do with your own body weight. So maybe some different exercises from also different perspectives. Okay, this is a combination of the biceps femoris on one side and the rectus femoris and the iliopsoas on the other. So these are more or less exercises, like I said, that can be done with your own body weight. But of course, the basic exercises that you can do on the machine, it can be used. It's just the matter of how you would execute an exercise, how many repetitions would you do, how many sets. This can all be,
That's me.
So yeah, it's like I said, we sometimes, if necessary, we give all the information that are needed to go into the direction that was prescribed. But on the other hand, most of our customers, they actually, they have enough knowledge to develop on their own. This is okay, maybe not the best activation exercise, especially not with this speed of contraction, but it's all about setting up an exercise in the way that you have to search for a combination of effectiveness and simplicity of using it. So this is one of the exercises. Sometimes you need some small accessories that makes everything even a little bit more effective.
Maybe I just said, sometimes, people see this recommendation of the exercise, and they look very simple, and usually we're not used to train in this way. But basically this all comes together with TMG, If you have selective information about the muscles, then you also can use or should use muscles which try to, exercise which try to isolate the muscle as much as possible. If, for example, you would be using some other technology where, let's say, you only have the information about the group of the muscles, or even, let's say, some performance test like, vertical jumping or something like that, then of course the intervention in terms of exercise would be different, So, and then we had a discussion yesterday with the team, after a couple of beers, he says, look, I don't understand TMG is so simple for me, so how come? And I said, I don't know, but I know that Albert Einstein said that if it's not simple, either you don't understand it or it doesn't work. So for me, simple is beautiful. And the same thing is with this exercise. They should be simple if you want them to really try to hit the spot. Maybe it's not simple to make it, so you have to ask the athlete. At least it should be seen like simple. So, please, shoot with another questions.
Do you think probe placement's an issue? The variability in
Sure. Yes, for sure. So the position of...
And do you think that probe placement is an issue in the variability? So
It is.
what sort of things are being done to try and...
Yeah, so I think we'll hear about the reliability and repeatability a little bit later. Yeah, but the thing is, of course, what you want to get, you want to have the position which is standardized. So in most cases, if the muscle is nicely shaped, like for example the biceps here, and it's almost a cylinder muscle. So you will just look for the center of the muscle belly, because in that area you will get the biggest displacement, so you will have also the most muscle fibers covered in that way. In some cases the muscles react slightly different than you would think. For example, when you're measuring the lateral quadricep head here, in this case it's a big muscle. If you would look for the center, it would probably be somewhere around here, but it is covered by iliotibial band, and also the other thing that happens during the contraction, it doesn't form a belly into that direction. It actually moves away because it moves medially when the muscle is contracted. So these are the things that of course need to be taken into account when positioning. So this is one of the reasons why we always but probably we don't sell the TMG without the training. There are some guidelines that you can do in writing. You can get in writing. Also, you have for example, you can use an anatomical guide for electromyographers that use needle, and the position of the sensor tip. In this case, it's almost identical to the position that they're using, but it's always easier if you just have somebody to show you how to position and also tell you why you should position in that way. And if you use the same guidelines all the time, then repeatability is very high, especially for those parameters that I was talking about. But of course, if you would put TMG into 5 different hands with no training, you would get results all over the place. Yeah.
Can I just ask a follow-up question to that? A bit of a leading question. My background's in biophysics and instrumentation. I'm always looking for errors, wherever I can work out why something could go wrong in that way. Is it probably the case that when you position the electrodes, because you actually tune the stimulus based on where it's positioned at any one time, does that normalise the problem?
For stimulation, maybe yes, but not for the position of the sensor tip, because the sensor tip, so if you have a big muscle, the position of the electrode will not affect the results all that much. But if you position, for example, of course, if you take the sensor tip and you put it here in the center of the muscle belly, or if you put it here, you would get quite a different result. But again, why would you put it here? Because what you're looking for the area of the muscle belly where you will have the biggest displacement, so where you will have a lot of muscle fibers coming together, forming a deformation. So this is something that you always need to consider when you're positioning the sensor. So you cannot put it just anywhere on the muscle, but even if you use the EMG, you have to follow the same standards. So yes, it will affect.
Just to add, maybe it looks like complicated, but we have most of the cases. People say that it was quite easy to learn. I mean, okay, if you use it daily, maybe 1 week, 2 weeks. If you use it, I don't know, once per month, then maybe it's a different story. But it's not a rocket science. The maybe more important question is, now I have the information. Now what to do it. I remember I was in high performance center in Baylor University in Texas. There were like 12 guys. Described all of this, and then the boss says, okay, now to his stuff. Now, what will we do? Now we know. Because he says, ignorance is bliss. If you don't know it, we have no problem. If we know that something should be changed, and we don't have a consensus of what to do next, then it's even worse. So, and that is, by our experience, something which goes hand in hand between, some part of this knowledge is transferred, but also then the second phase would be when you overlap, you more experience, more knowledge on top of this and make this like the routine. I mean, if you use it in practice for 1 year, you don't even think about it. You see some numbers and you know what to do. I mean, this is like driving a car, but not on the day one in the school, but later.
So if you're working with athletes, then it should be quite easy to detect the best position. If you're working with some special populations, you can also use some irritation points on the skeleton to position. So if you cannot see where the muscle belly is, if you cannot palpate it, because sometimes some patients, they don't have the ability to use their muscles in the way that they should be used. So you can just use the orientation points on the skeleton. And if you use the same criteria, you should get very stable results.
So Karen, now, please, where would the coffee be served?
Coffee, you'd be glad to hear it. I'm hoping just at the bottom of these stairs.
So just to
Yes,
say
10
some
minutes,
last thing,
yeah.
I mean, we don't come in so many people to Leeds, for example, just because we like sightseeing. We're here so that we would speak with you. I mean, I understand that many times people don't ask questions in the audience, so please feel confident. And I mean, we're really here to have one-on-one discussions. I mean, whatever questions you might have. So that's why that's why I wear orange. So it's no problem if you go after the lobby.
There's brochures and information at the front here as well.